I got a note from my friend Kevin the other day at GRMC telling me, look, if you're interested, our social services team is willing to talk to you about what they do to find insurance company for our uninsured patients and, you know, get them in things like MIP, Medicare, Medicaid. And I thought, okay, that actually sounds pretty good, because I know that there are a lot of people that have heard of GRMC and have thought to themselves, I don't have any insurance, so that won't be happening anytime soon. Not necessarily, in fact. Apparently, we've got with us here in the studio, we've got Kim Dunlap, Tasi Taitano, and Jean, how do you say your last name?
Dimaano.
Dimaano. Don't worry, Paul's got your microphone already on. Just pull out. Don't be afraid of the microphone. It's not afraid of you. So we're just glad to have you in the studio. So you're actually all working together full-time to help find patients coverage? Is that right? Okay, well, maybe who should we start talking with, do you think? You're like, let's just point at Kim. Kim is our our main social worker here. Is it a GRMC social worker? Welcome to the show.
Well, thank you very much. I am one of the 3 social workers currently employed at GRMC.
Okay, yes. And so you were educated at Georgia State University?
Yes, I obtained my undergraduate social work degree from there. And I went on to Valdosta State University in Georgia to obtain my master's degree.
Oh, okay, fantastic. So you've been doing social work for over the last 5 years, and you had been working, I guess, in Georgia to within the city school system?
Yes.
Okay, is that a pretty depressed area where not everybody has insurance?
Well, in the school system, the population is quite different. The target is quite different. I worked mainly with the homeless students and their families. So we don't focus so much on insurance, but occasionally we do run into issues with insurance barriers. But here in Guam, my population is quite different. We work with the medical ill and those who are facing ailments who need medical services. So it falls back to whether they're covered or not, and we want to make sure that we have the proper coverage for them so they can continue to receive medical treatment going forward if they haven't have any treatment at that point.
Oh, okay. And now I was reading in your bio that you are originally from Vietnam?
Yes, I am.
Okay. Is this like the really wealthy part of Vietnam where everybody's got all the money that they need that I see on TV?
Definitely not. Vietnam is still a third world country. Welfare is not an option for us there. So we face barriers just as we would with any other third world countries.
Oh, okay. So, I mean, sometimes that makes it a little bit easier when people know that you've kind of walked in their shoes before and have grown up in an area where there wasn't just money everywhere.
Yes, definitely makes us more sympathetic to the population that we work with.
Oh, okay. And how long have you been working for GRMC?
I've been here since January of this year, and it's been a pleasure to be part of this team.
Fantastic. All right. Well, really nice to meet you. I'm going to ask Tasi a couple of questions here. Tasi Faith Taitano. That sounds, call me crazy, but that sounds like a pretty local name.
It quite is.
Okay. Now, you have a degree from, let's see, Northern Marianas College. Are you from Saipan?
I'm from Rhoda.
Oh, okay.
Yeah,
from the
but
lovely,
I did go to Saipan.
Oh, okay, from the lovely island of Luta. And then from there, you go to NMC, and then you go off island to get your master's in social work from the University of Hawaii at Manoa. And so how did you get hooked up with GRMC?
So I came over to GRMC in March. I'm actually the newest of the bunch here. I felt like I was working in home care hospice in March, but I felt like I needed something a little bit different, still enjoying the medical field. So I decided to come over to the hospital, and thankfully I got hired, and I really do love where I'm at right now.
Oh, okay. Well, very cool. And then we have the final member of our team, Jean. I'm going to be asking you all afternoon. Could you say your last name again?
Dimaano.
Dimaano. Okay, that's not hard. And Jean, you come to us also, well, actually with a minor in bachelor in social work and a minor in sociology. Oh, from right here on Guam.
Yes, from University of Guam.
Fantastic. And so how did you come to work for GRMC?
Well, I used to work at a homeless shelter, and with the homeless shelter, I deal with the population of people that are unemployed, losing housing, and just different walks of life. And I do have a background in the healthcare field, and I decided I wanted to just be exposed to the hospital area.
Okay, all right. Well, so how does this work exactly at GRMC? I walk into the hospital, and maybe I've got some serious medical problem. Is it okay to just walk in, if I can walk in? I'm worried about where the ambulance is taking me. Maybe I don't want to go there because I know I don't have insurance. What happens then?
We want to break that misconception that GRMC does not provide services to patients who are uninsured or underinsured. We welcome all patients, and we service all patients, particularly for those who need critical medical care. If you walk in with a serious medical condition, we will treat you based on the EMTALA Act, and we will provide services to you regardless if you have insurance or not.
Oh, okay. All right. Well, let's say I walk in with someone, and maybe they get their prenatal checkups somewhere else, or maybe they didn't have any prenatal checkups, but they are absolutely having a baby. And they walk in, and, it's pretty urgent because they're having a baby. What's the process that happens?
So what we do is, particularly if you're in the process of delivery, you will be seen through our ER department, and the care will be provided there. We'll move the patient into our labor and delivery room and department. We will not question you regarding your insurance until you're stable and you're in a condition to provide those information. And if you are not insured, we will still provide the same service as we would with or without the insurance information.
Oh, okay. Well, that's good news. It's not like you're going to go, okay, we're all set to go. The baby's starting to crown, and do you have insurance?
No.
Yeah, because that's going to be a really not a happy situation. Okay. Yeah. Well, then how does it work? What sort of insurance options are there? Who would like to go through that? Tasi, maybe? Or?
Sure. So, like Kim had mentioned, in the emergency department, we don't ask right then and there, do you have insurance or not? After everything is settled, the patient is stable, if they have delivered indeed, our nurses and our doctors then find out, through conversation with the patient, and then trying to prepare for when they're ready to go home, find out that, okay, maybe they don't have insurance. So then there's a social work consult that's placed, whether that be verbally or in the hallway when we're stopped by walking, or an actual all scripts. It's a system that we run at GRMC. So an actual consult is placed. We find sometimes they put self-pay. Those are kind of indicating that they don't have some kind of insurance.
Okay.
So we come in, provide the assessment. We go through if they're there long enough, we go through a whole biopsychosocial type of assessment to try and address not just the insurance, but also what other barriers there may be in the home. Sometimes they don't have power or water. We try and address that, but in terms of insurance, we provide them public assistance applications if they do meet the criteria, or at least based on the conversation, income-wise and whatnot. We provide them with the packet, maybe even some Social Security applications. We provide them information on where to get the original birth certificate, basically everything that goes with a public assistance application. We let them know the steps. Sometimes we write down a whole set of number 1, do this, number 2, do that, in the event that they don't necessarily know how. And then we have them run that to public health and then start the process there.
Okay, well, on the few times that I've been to a hospital for emergency, I don't really feel like dealing with the insurance aspect of things right away. Sometimes it was quite a while before I was even coherent enough to figure out what it is that I was supposed to be doing, or the questions that people were asking me. What do you do in that event?
So in the case of the prenatal, the delivery, now we don't require them, to go right then and there, only because, of course, you just gave birth, and as any mother would know, it is difficult. I have 2 children, so I know the feeling. We do provide them as much education and the documents to take home, or the application packet when you're feeling a little better. Be filling it out while we're waiting to actually go to the businesses to apply. Now, for those who have come in for a different type of circumstance or medical ailment, like, you know, maybe they fractured a hip or they come in and they have shortness of breath. Now, for those patients, we definitely need to, one, have the family involvement to try and get these documents through public health, especially if they're needing some kind of medical equipment when they're going to go home. It is very difficult to get any kind of continuation of care, whether that be home care, hospice care, or medical equipment down to oxygen or a wheelchair without any kind of insurance.
Okay, now what about limitations on insurance? For example, let's say the girl that's pregnant in this case goes, I have Take Care insurance. You know, there are some insurances that seem to work better with GRMC than others. Like, can I still go to the hospital? What portion does it pay? And that can be a little confusing as well. Tell you what, why don't you hang on to that one, Gene? And what we're going to do is take a look at island traffic, and then you can answer for that for me on the other side of our quick break. Would that be okay?
Sure.
Okay, fantastic. We've got Gene, Tasi, and Kim, and see, we're on first-name basis already because we're talking about insurance. You know, I don't know nothing about birth and no babies, but they do at GRMC, and they're going to help us with that, insurance, and a whole lot more. So this is a conversation that I've been wanting to have for a while, and one that I don't want to rush. It's with the social workers at GRMC, and they're talking about insurance, and we're learning a couple important things. One, if you got an emergency, you get a GRMC, you're in, no matter what. They've got to take you in. That's the law. Number two, if you're feeling bad and you don't have insurance, you walk up, you know, and you don't have the money to pay, they could kick you to the curb. But if it's emergency, more than likely they're going to let you in. And then, actually, they will let you in. They have to let you in. And they're going to try, even if you walk into the door, to figure out a way to get you on insurance so that you can be treated there. And we were talking about the different types of insurance. Not everybody's insurance pays the same. Gene, how do you figure out, you know, whose insurance pays what? Can anybody with insurance come to GRMC of the major island insurances?
Well, we do accept Medicare, Medicaid, of course, and MIP, and then private insurance, Select Care, Staywell, Netcare, Blue Cross, Aetna, and then Take Care. We accept them in our ED department, but we are currently under negotiation with them and looking forward to working with them. But definitely, if they are under some kind of insurance that has a co-pay, we definitely can assist the patients with other with MIP and Medicaid, depending on their income-wise.
Oh, okay. So currently no Take Care for anything except emergency visits.
Right now, yes.
Okay, but you are negotiating.
That's correct.
Do you know when that's going to be done? Any kind of, okay, it's kind of up in the air in the moment. But
that does not prevent Take Care patients from coming to see us for non-emergent issues. They would just have a different level of coverage.
Oh,
Take
really?
Care
Oh,
will
okay.
provide, will pay, reimburse, but at a lower level of coverage for them. So it will be a financial burden if they do come, just to expect, you know.
You're going to pay a little bit more,
yes.
but, you know, depending on what it is.
Yes.
You know, for example, you know, if I want to avail of some of the services that brought the guy back that was having a stroke, you know, I need to go to the stroke center. That might be, you know, that's worth the extra $1 to me.
Yes.
You know,
yes.
so I can come back and think about how I'm going to work that payment out. What is the percentage right now for Take Care?
Right now, we do have quite a few Take Care patients come through the ER. We see about 5 or 6 of them per week, an average.
Got it.
Yes.
Okay. Now, I was looking at the numbers on the emergency department visits, and it looks like a lot of them, most of them, in fact, are from Medicaid. Is that right?
Medicaid and MIP.
Okay, and Medicaid, is that the one? Which one is it, for the senior citizens or for the indigent?
U.S.
Medicaid is for low-income U.S. citizens.
Oh, low-income U.S. citizens. Okay, and then the next highest number is self-pay. That's like looks like just over 1,100, and then 783 are from MIP.
Yes.
Okay, and so you can use that as well. I've got Pete on the line with a quick question here before the top of the hour, and I'm not going to rush you out of here because I have a lot more questions. Do you have time to stay?
Of course.
Okay, good. Glad to hear it. We've got Pete. Pete, welcome to the program. Thanks for joining us. What's your question for our social workers from GRMC?
Yeah, how do they plan to not end up like GMH with people that don't pay their bills?
Oh, okay. Well, that's a good question. Thanks, Pete. How do you not get in the hole as far as bills and things? Is that not your end of things, or what do you do?
I think it's a struggle nationwide. Every hospital deals with some sort of financial conflicts when we service uninsured patients. What we do is we just have to work more diligently to provide education and reinforcement to our patients and their families, to talk about how important it is to be insured. In the event that you're not there for an emergency, but you still need medical care, you want that coverage, so you want the services. It takes education, not just only from the social workers at GRMC, but also from the community.
What about TRICARE, just while I'm thinking about it?
We do accept TRICARE as well.
Okay, all right. So Tri-West and Veterans Administration?
Mm-hmm. Those are VA insurance.
Oh, okay. So you guys cover all that stuff? So I don't have to go to the little clinic, I can go to the big hospital?
You can come to the big hospital.
That would be much better. Okay.
I think every hospital ends up absorbing some sort of cost due to uninsured and self-pay patients. It's an ordeal that you can't evade, but this is the thing that the community needs, is a hospital to care for them. So we do take up some of that loss, but overall the most important thing is our patients get treated. The people of Guam get to receive the medical care that they deserve.
Kim, Tasi, and Jean, our social worker team from GRMC, will join us on the other side of the CBS News. You're listening to us for the first day with the tower working of 10,000 megawatts of AM. K57, if you were planning to swing to the Bank of Guam to quickly cash your paycheck earlier today, whoa, Nelly, the parking lot was full. I about got run over just walking outside for a moment. That is good news. People have a whole bunch of money in their pockets, and people are going to be out tonight. So be on the lookout. Maybe bargain a little bit of extra time for yourself, for your family. I mean, you want to live long enough to spend that money, am I right? Now, one thing that can eat up money really quick is health care. But the fact of the matter is, you have a little bit of choice here on Guam as far as health care, more than you used to. This last hour, we've been talking to the folks from the Guam Regional Medical City. It's our team of social workers, Kim Dunlap, Tasi Taitano, and Jean Dimaano. And that team actually makes sure that they give you every chance that you possibly can get to share your information, your insurance information with them, to even sign you up for insurance if you don't have insurance, for MIP, for Medicare, for whatever that you might qualify for. They don't turn anybody away. Get this out of your head right now. You got an emergency, you go to GRMC, they are going to treat you just like at any other hospital that must take you. They're going to take you, they're going to treat you, and they'll sort out the insurance stuff afterwards if it's an emergency. Now, if it's a case where you can just walk in and it's not really an emergency, yeah, you're going to have a conversation about it, what insurance you have. They take Select Care, Stay Well, Moylan's Netcare, Blue Cross Blue Shield, Aetna Plans, United Healthcare. And really, we're just talking to them about how the whole process works. How long does this conversation take, ladies, when it comes to going to the hospital and having the conversation about insurance? I would imagine there are some first questions, some second-tier questions, some third-tier questions. Tasi, you look like you would like to answer that one. Let's just say I walk in, and I'm like, I think I broke my finger. I mean, it's not emergency, but it really hurts. What happens to me there from that point?
Well, at that point, you're signing in, you're registering, things like that. The ladies and gentlemen in the front signing you in will help you. Of course, you go through triage, and then you're seen by the doctor and the nurses. Now, when we come in is after the consult has been made again, whether it be verbal or via the computer system. We, as social workers, we enjoy doing biopsychosocial assessments.
What does that even mean? It sounds scary.
It's not scary, but it's just kind of what
What is this?
we just basically get some background information about the person, about the patient. First and foremost, definitely ask how they're doing, make that introduction, kind of build a relationship in where I really am here to help you as opposed to kind of be against you. Sometimes that's difficult to get across.
Yeah, because I'm thinking you're not going to treat me if I don't have the right insurance.
Yeah, or they think sometimes social workers kind of get the why do I need a social worker, I'm not crazy, or my kids are not getting taken away, things like that. But we try and let them know that what we're there for is to help them, one, while they're in the hospital, address all their needs, if there's anything they need for home and things like that. So when we kind of make that presentation that we really are there and we really do want to care for them, they kind of are more receptive to our assistance, kind of get their home background, their biology, their demographics.
You're not trying to keep me out. You're trying to find a way to keep me in.
I'm trying to find a way to keep you in and help you.
Okay, that's pretty simple, but that's a big difference.
I think one of the things that we really focus on is that we are medical social workers. We're there to help patients who are facing substantial and often challenging medical issues. We're there to help them cope with the illness, the diagnosis, and we're there to help their families cope with the hospitalization as well. It could be overbearing for our patients and their families. When we conduct our assessment, we don't just ask about insurance, as Tasi mentioned. We do a whole thorough assessment, a biopsychosocial. We address their psychological concerns, their emotional, social, spiritual, and physical.
Oh, okay.
Yes.
So you're just not treating me like a number.
No, you're just how much do you make or where do you work?
I feel like I'm going crazy. Yeah, whatever. What's your insurance number again?
No,
nothing like that. Okay. Yeah. You're like, so making sure that I'm calm, my family's calm, nobody's freaking out. Okay. Well, I mean, and that makes a difference as well, because if you get treated like a number, and that has happened, been to the hospital, and very, very, very uncomfortable, and just folks not so much focused on my the relief of my pain or recognizing that I'm in extreme pain. That I mean, that really does make a big difference.
Our role there is to support our team, but most importantly is to support our patients so that we can stabilize them and help them regain their social functioning upon discharge.
Okay.
Financial concerns is a big part of it. Our patients come in who are uninsured. They do get overwhelmed. They do get overstressed due to financial issues. And a lot of patients come in and ask about their bills and express how worried they are. And how will they be able to pay the bills? And what we do is we comfort them and provide the necessary resources and education so that we can sign them up for some sort of public health insurance, or if they're qualified for Medicare, we're there to help them. Call the Social Security office. We do what we can to help our patients.
Okay, well, I mean, that makes a difference, too, depending on which patient it is. You know, it's one of the kids, you're like, it's no problem, we'll find a way to cover it. If it's you, you're like, I still have to hit the grocery bill at the end of the week. How am I going to do that? So even having conversations about that kind of thing is okay.
Yes.
It's not out of bounds. Okay. Now, I didn't realize, really, until I had read some of your bios, that for example, Kim, you've got your bachelor's degree in social work, and then you've got a master's degree in social work, for example, from Valdosta State. I wasn't aware that there was that level of education or training or expertise involved in this whole process.
Yes.
Because I think people might mistake you. They're thinking you're a glorified receptionist, but that's not the case.
That's quite interesting, because the level of education that we have to have is so that we're able to provide the most effective services to our patients. We do more than just financial assistance. We provide therapeutic interventions, psychotherapy, counseling, as we mentioned earlier, to help our patients cope with their illnesses. We also provide resources and connected them to the community and providing the proper support groups. But most important, these skills require for us to be updated, to be educated, and to understand the proper way to maneuvers around the difficulty of just the dynamic of the human level and the human services.
No, Tasi, are you guys all there at the same time? You just walk in and everybody sort of converges on them, or is there one person who's the social worker on duty, or how does that work?
All three of us work basically Monday through Friday, 8 to 5. However, a social worker's job is never just 8 to 5. We have an on-call schedule, so someone is always available via phone, and that's accessible through our operator and our nurses and our doctors. We get calls in the middle of the night, throughout the weekend, so one of us is always on call. Depending on the situation, there may be reasons as to why we go in after hours or on the weekend, but more often, we try and address things over the phone if not.
Okay, well, what are some of the common questions that people ask on the phone? I'm the king of asking not the right questions. What do people mostly ask you?
A lot of times it's about continuation of care, who will help the patient when they get home, when they need medical equipment, how do we get that for them. Sometimes there's barriers, as in there's no one at home to take care of them. If they're a single household person, what are we going to do? So that's when we come in and we try and figure out if there's family or friends that we'll be able to take them in, or if there's a placement that a place that we can properly place them in. We help with that.
Oh, okay. So that can be that could be a huge thing. People really don't think of, I'm feeling better, I can go home, I'm all better. No, that's not really how it works usually. If you've had a major, catastrophic,
Sure.
problem.
If we feel like there's someone that needs to take care of you, if you cannot take care of yourself, or in this case, activities of daily living is a terminology, we try and figure out where to place you. If there's nowhere possible, often we keep them in the hospital until we feel it's safe for them to go home or be at an independent level.
Jane, I wanted to ask you about this in particular because, up north in Dededo, there are a lot of people that are wandering around and you feel bad for them. Maybe they get hit by a car or something, bitten by a stray dog, and you're like, I want to help you. I don't even know how to help you. Like the homeless community, do you folks deal with the homeless?
In the hospital, definitely. We do get a lot of homeless cases that are admitted at the hospital, and what we do is, of course, being in the homeless background, I definitely connect them with the resources that I know of, with the homeless community here in the island, and as we speak, I'm still working with some of the homeless cases that I refer to them, and hopefully get them to a more permanent housing placement.
Oh, okay. So you want to get their situation squared away and get them insurance so that, so that everybody gets paid at the hospital.
That's correct. Even if they're discharged from our hospital, if their placement are only temporary when they're discharged, we don't necessarily let go of that, case. We actually still work with that patient and, with the different community providers that can assist this patient. We still work with them.
Is the level of care that I receive going to be the same depending on, like, what kind of, I got really great insurance, will my care be different than someone that's barely insured at all?
No, it's going to be the same. It really just depends on what care do you need, and we will provide as much as we can and, do whatever intervention is needed on your specific case.
Okay, I'm probably not going to be needing an obstetrician or a gynecologist real soon, but my girlfriend will be.
Yes.
And she's got, her favorite. I guess the question is, who gets to practice at what hospital? Is that something that you need to ask your doctor? Do you guys know? Like, for example, are there rules about who has? I mean, there's got to be rules about who has hospital privileges and who doesn't. Is there a list somewhere?
Yes.
And where is that somewhere? Do you guys know? Kevin knows. He's like, I'll send it to you. Kevin will send it to me.
We do have a list of...
it's Kevin the Mime, who's also here in the studio. You won't hear from him on the mic.
Yes. So our hospitalists and our physicians who have privileges at GRMC is determined by our GRMC staff and our executives or administrators. If you don't have privileges, maybe an exception could be made if the specialty is in urgent need and we don't have that there. We've made exceptions like that in the past where we've allowed physicians to come in and treat our patients, but only in an urgent case, and we don't have that specialty at that moment.
I see. Yeah. So mostly hospitalists are going to take care of the the main things at the hospital.
Yes.
How many hospitalists do you have?
We have 2 hospitalists up on our lower level cares, our med surgical and our med tele. But down in the ER, we have our own physicians down there in the ER. And the other physicians are there for specialty services.
Okay, and Kevin Kerrigan actually had a list of all of the GRMC staff physicians as of 9/1/16. So I want to go through that, believe it or not, in a minute. First, though, we're going to take a call from one of our listeners, and because Kevin's looking at me like, "Hey, this doesn't have anything to do with insurance. What are you asking these guys?" I'm just kidding. They're very knowledgeable in general. And we've got Art joining us here on the program with a comment for all of you. Good afternoon, Art.
Hi, Travis.
Hi.
I just got out of GMH. I spent some time in their emergency room and awful experience in a regular room, and I decided I don't want to go back there again. I live in Agate, so when I had my emergency at 2 o'clock in the morning, it didn't dawn on me that I would have the option. I figured I'd have to go to GMH. I don't know why. But they took me to GMH. So my question now is, if I ask the ambulance driver to drive me to Dedido, will you guys take me? I have Medicare and Select Care, so I think I'm a paying patient.
Right. So, what do you guys know about this one?
Actually, it depends on your medical condition, how urgent is your case, and how critical you are. And if you're in critical need of services and medical attention, they will take you to the closest medical facility possible. Now, if you're not in dire need, you could have the option of requesting to be transferred to GRMC, and if we have the capacity to accept you, we will accept you.
Okay, that's what I tried to call my insurance company. They basically told me the same thing. I even called the ambulance in Agate at the fire station, and he told me the same thing. He said, as long as you're not bleeding to death and having a heart attack right there in front of us, you can handle 20 minutes more in the ambulance. We'll take you wherever you want to go. So,
hey, Art, that's a great question. Thank you very much for asking it.
All right, thanks.
Okay, no problem at all. Okay, if that was the one single question that we got answered on the program today, I'd want it to be that, or they're not going to turn anybody away if there's an emergency. And the other thing is that they've got an entire social worker team to work with you on your insurance. They've got just about everything that you can think of, except for Take Care, and they're working on that. They will charge you a percentage. It's not like they're going to turn you away. In an emergency, that's a whole different situation. They will take you. The answer to that is they will take you.
Yes.
And ultimately, though, the goal, I'm sure, is to work out a deal with all private insurance carriers here on the island of Guam, and we'll keep you posted as to when that comes up. Thank you very much, ladies, for stopping by this afternoon. Is there anything that you wanted to add that I didn't get to?
I just wanted to rephrase earlier. I mentioned that we have 2 hospitalists. I'm referring to 2 hospitalists on duty per day. Yes. We have more than 2 hospitalists at the hospital.
I was going to say, those guys are really busy.
I don't want anyone to misunderstand that statement.
Now, you're open 24/7, right?
Yes, we are.
Okay.
We welcome any physicians if they want to.
And yes, we're always looking to recruit specialty physicians or anyone who's interested in the medical field. GRMC is a great place to start those opportunities.
Okay, well, thank you very much. So, once again, if you're there and you're asking about insurance, odds are you're talking to Kim, Tasi, or Jean, and they will help you find your way with your insurance needs and your medical...
Biopsychosocial assessment.
See? And they won't correct you like that, ever.
No.
Biopsychosocial assessment.
Just for anything that they need in the hospital, feel free to request for a social worker. We'll be there to assess and assist with any type of needs.
Excellent. I got one last question from Roki on Social Security. Roki, go ahead.
Hi. When my father was in the States, in California, getting under the Social Security insurance, the doctor told my dad, they told us, you have to take your father home because there's nothing we can do about him. Only to find out later on that if the doctor's budget came up, the Social Security budget comes up to $200,000, they release you. They won't do nothing about you anymore. And that was kind of bad because if you're still sick, they'll tell you to go home because there's nothing they can do about you because the budget already reached $200,000.
Okay, Roki, what I'm going to do is I'm going to give you a number to call so that you can finish this particular line of discussion because we're running a little bit short on time and we need to get to the news this hour. The number you want to call is 645-5500. Okay? That once again, Roki, that's 645-5500.
What's your extension?
Extension 5512.
Extension 5512. It's like you got to say it up like that, like you got educated in Valdosta, Georgia. Okay. Right on. Very cool. We're going to take a break. Actually, we're not. We're going to go on the go, and then we're going to get the news. Thank you, Roki, for the call.